Still on SHA matters, the Ministry of Health is seeking an additional 6 billion shillings in the supplementary budget to boost the Primary Healthcare Fund and the Emergency and Chronic Illness Fund under the Social Health Authority. Appearing before National Assembly's Health Committee, Medical Services Principal Secretary Harry Kimtai says the SHA benefits continue to be revised upwards based on availability of funds. According to Kimtai, a gazette notice has already been submitted to allow the revised oncology benefits from 400,000 shillings to 550,000 shillings to take effect. Emily Chebet has that report.
The Ministry of Health is seeking additional funding to strengthen primary health care and critical illness coverage. Medical Services Principal Secretary Harry Kimtai defended the ministry's budget allocations before the National Assembly Committee on Health and pushed for more funds to support the Social Health Authority and other operations within the ministry.
When you have paid your premiums, the social health insurance premiums, you will be entitled, if it is cancer case, whatever you will be treated from level 4, 5, and 6, as long as you are accessing cancer treatment, the benefit package that you are entitled is now going to be 550 and not 400 as per the previous benefit or tariffs that we had published.
According to Kimtai, the Social Health Authority has so far registered 20.2 million Kenyans, reinforcing the need for an additional 3 billion Kenya shillings to boost primary health care at the level 1, 2 and 3 hospitals, where services remain free for all registered members.
Primary health care, it is not restricted to the public facilities. It goes faith-based, private, all facilities who have been contracted at the level 2 and level 3, they are entitled, and the payment is based on the capitation. All right?
Kimtai appeared alongside other heads of semi-autonomous government agencies under the State Department for Medical Services who were taken to task on hitches that Kenyans are facing within the medical scheme.
You are just paying money bracket. They don't know what they have been paid. You can't explain you have been paid what because they can't view the system. But in NHIF, they are able to say, I've been paid 2 million, 200,000 for this patient, 50,000 for this patient.
We have agreed that we are publishing now the amounts we are paying to healthcare providers, and this will include all facilities that we are paying. This will help the public and any other interested party to be able to know how much has been paid to which provider for what purpose.
The PS says they are working to address all the challenges that the medical scheme has been facing since its inception, adding that all the packages within SHA will be revised upwards, subject to availability of funds.
In the event, and that's why this is emergency, chronic and critical illness, sometimes you exhaust your benefit entitlement, and therefore the ECCIF funds now sets in. One, to take care of additional treatment that will be required, and those protocols are there.
I think the ministry is finalizing on the tariffs and the benefits review committee, and we had agreed that most of the other areas that have been raised by the public will be addressed through that committee, supported by the computations on how that will affect the money that is coming in and the money that will go out.
The Treasury was put on the spot over what members and the ministry officials say are delays and sometimes lack of disbursement of agreed monies to healthcare facilities. Emily Chebet, Citizen TV, Nairobi.